Kia ora koutou, and thanks for taking the time to join us today. I'm Kiri Richards. I'm the Associate Deputy Director General for Mental Health, Addiction and Suicide Prevention here at the Ministry of Health. As you know, we're currently consulting on a draft mental health and wellbeing strategy. And this strategy is important because it will help shape how mental health, addiction, and wellbeing services are planned, funded, and improved over the next 10 years. And this consultation is important because it's an opportunity to step back and ask the bigger questions. So what kind of mental health and well-being system do we want for the future? What should we focus on? And what needs to change to make the biggest difference for people, whānau, and communities? So thank you so much for making the time to join us today. We wanted to hold this session to make sure you have the information you need to decide whether and how you'd like to take part in this national consultation process. You don't need to be an expert to have your say. Your experiences, insights, and perspectives all matter, and we want to hear from you. And your feedback during this consultation process can influence the final strategy and what happens next. So before we kick off, I'll ask Ikemoke to open the space, and then I'll go over what we're covering today.
Nō reira tēnā koe, Kiri. Nō reira e ngā rauranga tira mā, nau mai, hara mai, whakatau mai rā. Whakatau mai rā e ringi te ahuatanga o mātou kaupapa e wānanga tahi nei I tēnei rangi. Nā te mea, e tuku o mātou whakaro ki te atua I rungarawa, e uhia mai ngā manaakitanga ki runga kia tātou. Hoi anō, e tuku o mātou aroha kia rātou, rātou te hunga ora kua pāngia e te huarere o tira, mātou whanaunga e māwiwi ana I roto I ngā wākainga, e māwiwi ana I roto I ngā hohipera. E whakaaro nui anō kia rātou ngā whānau e noho pani ana, anō reire e ngā mati o te wā, haere, whakangaru atura. Nō reire hoki mai ki te kaupapa e huitahi nei I tēnei wā, e mi atu ki a koutou, nau mai whakatau mai rā, kawea mai o koutou pukenga, kawea mai o koutou kōrero, o koutou whakaro, e pāna ki tēnei kaupapa mo te hinengaro, anō reira tēnei te mihi. Ko tai mai te tira haere, hei manaaki hei tiaki a koutou whakaro, anō reira tēnei te mihi, tūturo a whiti whakamaua kia tīna, haumi e, hui e, tai ki e. Welcome everybody to the kaupapa today. In our karakia, we want to send our aroha to those affected by the recent weather events and also those who are unwell, who may find themselves unwell today. And also send our aroha to those experiencing bereavement. I believe it's only right to acknowledge those groups of people as we discuss the mental health and wellbeing strategy for 2026-2036. Nō reira e te iwi, e mea atu kia koutou katoa, nō reira tēnā koutou, and let's hand this time back to Kiri. Nō reira tēnā tātou katoa.
Kia ora, thanks for that. So today we'll cover three main things. So first we'll explain why we're developing a new strategy. Second, we'll walk through what's included in the draft strategy. And finally, we'll explain to you how you can be involved in the consultation process and share your views. This session only provides an overview, so really do encourage you to read the material on the ministry's website. And we'll also be answering some questions related to the process at the end of the presentation. But if something comes up as the presentation goes along, feel free to post it in the Q&A. So as you might be aware, in 2024, the Paiora Healthy Futures Act was changed to require the development of a mental health and wellbeing strategy. And so that means for the first time, New Zealand is statutorily required to have a national strategy focused on improving mental health and wellbeing over the long term. And so that includes both improving mental health and addiction supports and services, as well as preventing and reducing the harm from substance use and gambling. So the strategy looks at where we are now, what challenges and changes we need to make to prepare for the future, and where we want to head over the next 10 years. It will guide how the health system plans its work, invest resources, and improve services over time to improve the mental health and wellbeing outcomes of all New Zealanders. Also important to note, It sits alongside other strategies that guide the health sector, for example, the overarching health strategy and the Hawara Māori strategy as well. It will also be accompanied by an implementation plan with a shorter time frame, so focused on the first 3 years to drive action and accountability for the final strategy. And so both the final strategy and an implementation plan will be released later this year. So in terms of developing the draft strategy, if we're thinking about where we need to be in 10 years, we need to start with where we are. And so the legislation actually requires the strategy to include an assessment of the current state of mental health and well-being in New Zealand. So while most people in New Zealand report a good level of life satisfaction and well-being, we know this is not the case for everyone. So mental health conditions, gambling and substance-related harms, and mental distress are increasing. We know these issues start early in the life course, and we know they affect some communities more than others. Also, people with mental health and addiction needs experience inequitable health outcomes with higher rates of many health conditions and shorter life expectancy. And we know that this gap has increased over time. So overall, while many people are doing well, a growing number of New Zealanders are struggling, and the systems designed to support them are under pressure. And so that's the context this draft strategy was developed in. So the strategy also needs to look ahead. So in addition to current state assessment, the legislation requires the strategy to include an assessment of the medium to long-term trends that will affect mental health and well-being. So over the next 10 years, there are several important changes we need to be ready for as a system. So we're seeing increasing mental distress among young people. Our population is aging and becoming more diverse, with Māori, Pacific, and Asian communities making up a growing share of the population. Technology is changing how people expect to access care, including through digital and online tools. However, it's also increasing people's exposure to things like online gambling and having an impact on people's mental well-being and body image, for example. Driven in part by changing technology and methods, we know the illicit drug landscape is also changing, with new substances and patterns of harm emerging. And then finally, wider pressures like housing affordability, cost of living, and climate-related stress also shape people's mental health and well-being. So this strategy aims to move us towards a system that's flexible and responsive enough both to identify those changes as they come up and to adapt to them. So I'll give a quick overview of the draft strategy, and I'll note that it has been informed by data and evidence, but it's also been shaped by what people have told us over many years. So New Zealanders have shared their experiences of what works, what doesn't, and what they want to see change. People have said they want support earlier before problems become more serious. They want services that are easier to access, better connected, and work for them and are more responsive to their needs. And they want lived and living experience, whānau and communities to have a real influence on how services are designed and delivered. So all of that has shaped this draft strategy, and hopefully you can see that coming through. So this is the vision the draft strategy puts forward. It recognizes that mental health and well-being are just as important as physical health within the health system, and that they're interrelated, and that well-being is about both. And so through the consultation process, we're keen to hear people's thoughts on this vision and whether it resonates with you. To work towards this vision, the draft strategy is organized by and focuses on 4 priorities. And so these priorities have been confirmed by the government and the Minister for Mental Health and provide the overall structure for the strategy. For each priority area, you'll see that the draft strategy explains why it matters, what the future could look like, and then sets out the strategic actions to be taken over the longer term to make a difference in each of these areas. So I'll talk through each of these priorities now in a little bit more detail. So the first priority is about prevention and early intervention. And this means supporting people earlier in life as well as earlier when challenges begin, to prevent issues from becoming more serious. So it includes things like promoting mental well-being, improving people's understanding of mental health and addiction, and reducing harm from suicide, drugs, alcohol, and gambling. It also focuses on that life course view and making sure we have strong supports for parents, children, and young people, and working with other sectors to address the wider factors that affect well-being up front. So really recognizing that supporting people early can make a lifelong and big difference in outcomes. The second priority is about improving access to supports and services. So this means ensuring people can easily access the supports and services they need when they need them and in a way that works for them. It also focuses on ensuring better consistency in services across the country. So there are consistent options available no matter where you live. And we also want to make sure that mental health and addiction services are well connected and integrated. And that's across the continuum with digital supports and with the wider health and social sector. So people have a seamless experience of support and services. The third priority is about our workforce. So this is focused both on growing a broad range of workforces by attracting new people into the workforce and making it an appealing place to work, and ensuring current workforces are supported and feel valued. It also includes ensuring our workforce is representative and able to respond to the communities it serves. And you'll note a particular focus on the consumer peer support and lived experience workforce within this area as a particular priority for this strategy. And then finally, the fourth priority is about the effectiveness of our mental health and addiction system. So this means ensuring people are receiving high quality and safe services. This area acknowledges that lived experience and peer leadership is critical to an effective system, so looking to see that embedded strongly. It also focuses on ensuring we have the data and evidence we need to address current needs, while also preparing for risks and opportunities as they arise in the future. So those are the four priorities in a nutshell, and we want to hear from you across those four priorities. Are these the right things the health system should focus on to drive the kind of change you want to see in our system? So I'll hand over to Catherine, who's our Program Director for Community Engagement, to talk a bit more about the consultation process. Catherine?
Thanks, Kiri. Kia ora, everyone. I think the important thing to note is that at the moment, the strategy is only a draft, and we really need your help to hear what's important to you guys, to your whānau, to your communities, to shape up what that final strategy is going to look like and the implementation plan that's going to sit alongside it. So consultation on that draft is open till the 18th of May. And I'm now going to talk to you a little bit about how you can be involved, some of the steps we've taken to make sure that this is a safe, respectful and inclusive process for everyone who takes part. And I'm going to introduce some of the people that are going to help us with that. So I want to start by kind of introducing you to some of the lovely folks that are going to be supporting our online consultation sessions. Online, I think some of them are going to be in person too, that are happening over the course of the consultation period. These are the folks who we wanted to make sure that this was going to be a safe process for people, particularly because some of the subject matter we know can be a bit distressing for folks, and we want people to feel safe to give their free and frank feedback in a space where they feel comfortable. So these folks are also going to be involved in helping us ensure that when we're analysing all the feedback that comes in, it's being kept to the intent in which it was given, to make sure that we're taking people's real thoughts in when we're revising the strategy. So we've got two lived experience-led providers who are going to be providing online sessions and independent analysis of what comes back. And I'm going to start by introducing you to them. The lovely Gloria Sheridan from Te Kiti Pōnamu, do you want to introduce yourself and tell folks a little bit about the sessions you're running?
Kia ora, tēnā koe, Catherine. Ana mihi mahana aki moke mō tō karakia I tēnei wā. Kia ora koutou, kia ora e te whānau, I ngā mana, ngā reo, tēnā koutou katoa. Welcome everyone to all respective voices and people gathered here today. And mihi nui, waia. Ko Gloria Sheridan ahau, no Ngāti Porou, I noho ana ki tūranga nui a Kiwa. So my name is Gloria. I whakapapa tū Ngāti Porou and I'm currently living in Brisbane. Koe tēnei, he māngai no Te Kite Painamu. He mahi nui kia koutou kua tai mai I tēnei kaupapa. I te tautoko I tēnei kaupapa nui, te kōrero tahi mo te haura hinengaro me ngā ara whakaoranga. I raro I te maru o te rautaki haura me te oranga. I acknowledge and thank you all for being here to support this important kaupapa. We are very privileged as one of the partners to lead the Māori Lived and Living Experience consultation around the motu o tangata whenua, whānau, hāpuri and communities. My name is Gloria and I'm here as a representative of Te Kite Painamu, the inaugural Māori National Lived Experience National Rōpū. It is our privilege as one of the partners to lead the Māori Lived and Living Experience consultation around the motu with tangata whenua, whānau, hāpuri and communities who have walked these journeys. Our role is to uplift and honour those voices, ensuring that they are heard, valued and meaningfully reflected in the decisions that follow. Our engagement is grounded in tikanga Māori and guided by manaakitanga, whanaungatanga and kaitiakitanga. Participation is voluntary and confidential whānau. Spaces are led by Māori Lived Experience leadership. Our environments, we provide a safe, supportive and non-judgmental. The mana and tapu of kōrero is upheld, ensuring pūrākau is protected and accurately represented. We're especially looking forward to connecting with tangata Māori with lived and living experience of haura hinengaro and or substance recovery. Whānau supporting loved ones, tangata connected to services including NGO and community services, our tangata with experience of residential or acute care including compulsory care, SECAT, AOD, rehab, our rangatahi, our whaikaha community, our takatapui community, and our kaimahi with their own living expertise. As we move forward, it is critical that engagement is not seen as a step in the process, but as the foundation of it. The strategy will help to shape how systems are designed and how processes are formed. And if those systems are to truly serve our people, then they must be informed by the voices, experiences, and aspirations of those they are intended for. E tangata te pūtake, e hara I te tukanga. People must come first, their lived realities, their journeys of whakaoranga and their pathways to oranga. When we engage meaningfully, we are not just gathering inputs, we are establishing and enabling better decisions, stronger systems and outcomes that are grounded in authenticity, equity and mana. Te Kite Painamu is grounded in a clear purpose, to see the mauri of our people flourish, where well-being is holistic, hinengaro tinana wairua a whānau. Our vision is that Māori lived experiences not only informs systems, but leads them. We are guided by the enduring principles of e whakapūtanga, the affirmation of Māori rangatiratanga, and authority over our own narratives and well-being. Te tere te o waitangi. For us, these are not abstract concepts. They are lived responsibilities that shape how we show up, how we engage, lead, and how we hold this space. We invite mana whenua to come with openness and honesty, be willing to speak, and just as importantly, be willing to contribute to the significant mahi. This is a space for truth, where we can share the challenges and also the aspirations that hold for the future. Our hope is that what comes from today reflects us authentically, grounded in what is tika, what is puno, and what will truly make a difference for generations to come. Ko te tangata te mata puna o te oranga, e hara e te hangahanga. People are the source of well-being, not the solution, not the structure. Systems should be designed around people first, not processes. This is an opportunity for the people to design a system fit for purpose for everyone. Ia hata me nui o te ao, he tangata, nā reira, tēnā koutou, tēnā ra koutou katoa.
Kia ora, Chloe. That was beautiful. Thank you so much. That was a great description, and I'm sure you've encouraged a whole lot of people to get on board there. I'd now like to invite the lovely Megan from the other lived experience led organisation that we're working with, Changing Minds, to introduce herself and talk a little bit about the sessions that she's going to run.
Kia ora e te whanau, and kia ora, that was a beautiful introduction, Chloe, as well. Kia ora, ko Megan taku ingoa, ko tamaki makoro aho. My name is Megan Elizabeth, and I am the Engagement and Insights Manager here at Changing Minds. We are a national not-for-profit organisation. We are entirely led and operated by people who have walked their own lived experience journey of mental distress, addiction, or substance harm. We at Changing Minds nurture our tangata mato awhiako to embrace the mana of our lived experiences and see it as a source of collective strength. And we use that collective strength to activate equitable wellbeing in Aotearoa. What our mahi is, we work across broad areas of health advocacy, human rights, health policy, and we collect and nurture and activate our strategic voices as people with lived and living experience to create a brighter future. Changing Minds is really grateful to be part of this consultation series. We have had the privilege of being involved in earlier strategies and earlier pieces of mahi that feed into this wonderful opportunity. So to be able to bring community along once again and see our thoughts and our kōrero and journeys developing in this mahi is really important. Our team are hosting lived experience-led online hui over the next couple of weeks that is entirely supported by our lived experience team. So what you can expect from us is lived experience-led facilitators. We will have peer support kaimahi on hand during our sessions as well, because we know these topics bring up some strong feelings and emotions sometimes. And one thing that's really important to us is that we keep our online hui to small spaces to make sure that we have time and space and energy for everyone to feel welcome, to whakawhanongatanga, and to really leave feeling heard and have an opportunity to share their views. So we have 4 sessions that we are running, and as we see demand, we will add additional ones. But for now, we have 2 open sessions that are open to anybody with lived or living experience. The first one of these is this Thursday, and the other open session is happening the first week of May. We then also have 2 specialised sessions, one for our whānau who have experienced substance harm or addiction, and one for our whānau of tangata whaiora as well. And that's a specific space to share the experiences of supporting others through a wellbeing journey as well. What you can expect from our sessions, we open with whakawhanongatanga to get to know one another and then set out a group tikanga for the space so that we know that our voices are not only heard but are respected and that there's a safe space to share. All of our mahi is confidential, and as the wonderful Catherine mentioned, we're contributing to a report for this mahi as well to reassure anyone that all of our consultation, we de-identify all of our feedback and make sure that your privacy is respected throughout. And we will work through the group conversation together. We have a short activity at the end to work through some of the particular questions, and we're really encouraging you to bring any kōrero that feels important around this topic to those sessions. And then after the session, if you want to stay connected with Changing Minds for wellbeing support or for information, we're happy to organise that as well.
Thank you so much, Megan. That was another beautiful introduction. We're also going to be working with the wonderful Synergia and Shea Peter and Associates, who are going to be running our community sessions, and are going to be kind of leading the work on analysis of those sessions and the written submissions, and helping us with the kind of final shaping up of the report. So I'd really like to introduce Sharon Shea from Shea Peter and Associates and Belinda Baker from Synergia to introduce themselves and talk a little bit about the work that they're going to be doing over the next little while.
Kia ora, Catherine. Tēnei te mihi atu ki a koe e ke moke mō tō manaki I tēnei rā. Tēnā koutou, everybody. Ko waiau no Ngāti Ranginui, Ngāti Haua, Ngāti Hene, Ngāti Hako Ahau, ko Sharon Shea, tōku ingoa, tēnā rā koutou katoa. It's a great pleasure and a privilege, actually, to be part of this mahi. I'm the CEO of Shea Peter and Associates, and like our wonderful colleagues in Changing Minds and Te Kite Pounamu, we have worked collaboratively in similar spaces before. So hopefully we've met you in those spaces when we were doing engagement and consultation mahi, supporting the Ministry of Health in other spaces. We have the privilege of working with our partners Synergia, and my colleague Belinda's online, as you can see, so she'll talk about the detail of our mahi. But I wanted to introduce our organisation, and in the wise words that you've heard from our lived and living experience colleagues prior to us jumping on, there's a great deal of aroha and respect for the voices that we'll be hearing, the many voices, and we will always do our best to represent the truth of what is spoken, so that future strategies and system changes, improvement, outcomes are at the forefront of all of our mahi. So I'm just going to leave my intro there, and I'm going to pass over to my colleague Belinda. Kia ora, everyone.
Kia ora, thank you, Sharon. My name's Belinda, and I work alongside Sarah from Synergia, and we are privileged to be facilitating the online consultation sessions. We're looking forward to hearing people share their thoughts and feedback on the draft strategy so far. We've got 12 sessions, online sessions, 2 general public sessions, and then we have 8 other sessions with priority population groups. There would be youth, the rainbow community, women, rural, the Maori community, Asian community, older adults, workforce, tangata, waikaha, and the disabled community. So to be involved in them, you can go online and register, and you'll be sent a link. And then once again, we keep those sessions quite small, so we can, honour your voices and provide the feedback that's necessary. So yes, we look forward to hearing from you all, and thank you. Thanks, Catherine.
Thanks, Belinda, and thanks, Sharon. That was a great introduction from you guys as well. So as well as the online sessions that these lovely folks you've just heard from are hosting, there are lots of ways you can be involved in the consultation. If you are the sort of person that likes to take your time, have a bit of a think about things, then the online hub is actually a really helpful way of kind of putting your thoughts in, because you can save it at any stage and come back to it later. You just have to remember to have finished it off and sent it through by the 18th of May. We're also really aware that it can be a lot easier for people to share their thoughts among people they trust, and that some of you kind of are meeting with kind of people regularly that would be really keen to be involved in this and have their say. So we've developed a community toolkit to support people to run their own consultation sessions, take down what they've heard and send it back to us. And you can find resources to do that on our website. And at any stage, you can email us at the email address on the screen there for questions or to send through your thoughts. So it is really important that we hear from people. The This is a decade-long strategy. We want to make sure that anyone who wants to has had a chance to have their say in this. And it's really important to have kind of as broad feedback as possible to make sure that whatever gets developed at the end suits everyone, right? So we ask that you kind of share the opportunity of the consultation with all your networks. And if you've got people that need a bit of a hand to take part, then please do offer that support. We've got a whole lot of resources on the Ministry of Health website that can support you with that. And again, you can email us at any time if there's something else that you need or you've got any questions. And again, I just really want to reiterate that we've got steps in place to make sure that people's feedback is treated respectfully, authentically, and confidentially. So you heard from the providers how they're going to be looking after it. We've got the same processes in place at our end if you're sending through that online submission. So please rest assured that whatever you share with us is going to be well looked after and will help shape that final report, that final strategy, and the implementation plan that sits alongside it. So once the Minister for Mental Health and his colleagues in government have signed it off, we'll be sharing that and the final reports that come through from the providers you heard from earlier on our website. So, and we'll keep you posted. So just a reminder, consultation is running until the 18th of May. So you've got lots of opportunity to have your say. Resources, dates, links to things, all available on that website online, and you can send us any questions at any time. So I think some of you may have some questions now. Oh, before I get to that, I just want to remind people that if anything comes up, or if anything's come up today, or if anything comes up when you're writing your submission, when you're having conversations to support this, that supports are available. And again, you will have heard all those providers say if you're joining their sessions, they've got steps in place just in case anyone becomes distressed as they're engaging. We've got strong protocols in place all over the place to support you as you kind of share through this process. So again, any questions, send through to that. And I think we've got some questions now from people. So both Kiri and I are going to help you with questions. But if we don't get into them today, or there's any that are going to take a bit too long for us to kind of talk through or a bit out of scope, where, as Kiri said earlier, we will send written responses through. So our lovely colleague Heather is going to tell us what the questions are.
Yes. So we have a question about, are there any spaces for Pacifica for the consultation?
There are indeed. So the lovely Belinda didn't mention it when she was speaking about it, but Synergia have a Pacifica session, and we will we can get the dates for that through to you at a later date.
So through a different avenue, I've got a question of, can people go to more than one consultation session?
That's a good question. You absolutely can. So we recognise that you wear different hats. No one fits in a nice little box. You wear different hats and you might be bringing different things to different conversations. So you're absolutely welcome to attend more than one session. If you happen to have lived experience, you're welcome to join a lived experience session and online kind of open session if you want. We're all about people engaging in the way that best works for them.
So Kiri, there was some folks that joined just a little bit after you were introduced. So can you reintroduce yourself, because people didn't all catch your name and your title?
Yes, kia ora again. So I'm Kiri Richards. I'm the Associate Deputy Director General for Mental Health, Addiction and Suicide Prevention here at the Ministry of Health, and I'm working with the team to develop the strategy and implementation plan. So thank you again for joining early and participating in this process, and really look forward to the next steps.
Can you explain for people what will happen after the consultation period ends?
Yes, I can take that one. So as mentioned, our wonderful consultation providers will take all of the feedback received through the consultation process, and they will independently analyze and summarize that for the Ministry of Health. They'll present us with that final report, and we will use that feedback to update the final strategy and to develop the implementation plan for the first 3 years of that strategy period. Because this is a strategy that sits under legislation, it requires the Minister for Mental Health and Cabinet's sign off. So we'll be providing that advice back to government, following which we'll be able to release the final strategy, implementation plan, and consultation reports.
And we've got a question. Are there any spaces for migrant communities that aren't Asian?
So we are in the process of working with the Ministry for Ethnic Communities to develop some of those spaces. We're working really closely with them to make sure that we're, again, creating spaces that work for the communities that we're engaging with. So if you flick an email to that email address that's online right now, I will make sure that you can be kept up to date on those opportunities, and we'll also make them available on our website.
Do people have to complete the entire submission survey?
No. So there is a couple of compulsory questions. So we need to know, for example, what permissions you give. Like, are you happy for everything to be shared if we get an OAA, or are there things that you want to be kept quite personal? Aside from that, and I think a couple around your name, etc., some kind of demographic questions, you are free to answer as much or as little as you want. And if you choose to do it online too, you can, aside from the compulsory questions, you can answer as much or as little as you want. Basically anything you want to tell us, we want to hear.
We do have a few questions kind of more about the substance of the strategy. And so I think we want to encourage people to join the future consultation sessions that will get into the substance, correct?
Oh, yes. I think if you want to be having more of a conversation, or you want to be getting more into the nitty-gritty of what the consultation is all about, or why did you choose to have this rather than this, or put this here rather than this, that's what consultation's for. So really would encourage you to hop on the website. We had the link available earlier, and sign up for one of those sessions.
Another question. Yes, is the strategy being offered in other languages?
It is indeed. So not the full strategy because it's massive, but we've got a summary available on the website, which is plain language and kind of breaks the full strategy down into kind of the most important bits, which is available in about 12 different languages, including Te Reo Māori, and all the accessible formats that are available, except our Easy Read hasn't arrived yet, but I'm expecting it any day now.
And we don't have a question, but we have some information for folks. So for information, Platform is organizing consultation hui, also for their network, and for others who may want to participate. Memo Musa and Phyllis Tangatu will be providing opportunities for participation. So folks should hopefully be able to see that in the Q&A as well.
Awesome. We love that. I think we encourage everyone to kind of run their own sessions, get the word out, encourage others to participate. That's great.
All right. And are we explicitly engaging with children and young people?
Young people, yes. Children, no. But Kathleen, I'm coming to have a chat to you about that in a little bit.
Is it for non-substantive questions?
Oh, okay. Well, again, if you have further questions, or you kind of go away and percolate and something pops into your brain, feel free to send us through anything at the address that's on the screen now. And again, please do spread the word about this opportunity, because it really is important for people to have their say.
And I'll just quickly say a huge thank you to everyone who's joined us today, and thank you in advance for participating in this process. Hopefully you found today's information session helpful. We'll be posting a recording of it on the consultation website if you know anyone who missed it and wanted to attend. And again, really do encourage you to take the time to participate and make a submission. So I'll now ask Ikemoke to close us off. Kia ora.
Anō reira tēnā tātou. E te tuatai mea tu ki a koe Kiri, koutou ko Gloria, Megan, Sharon, Belinda, me atu ki a koutou e kawea mai o koutou kōrero i tēnei rangi. Hoi anō me atu ki a koe Catherine, tō mātou kai manaaki, hei manaaki hei tia ki a ngā kōrero, anō reira me atu ki a koe. Ki a koutou katoa, me anō ki a koutou, kua tai mai, hei manaaki hei tia ki tēnei kaupapa, anō reira tēnei te mihi. Aha koa ngā piki, aha koa ngā heke, kia tau iho ngā manaakitanga o te atua, ki runga ki a tātou katoa, tūturu a whiti whakamaua kia tīna, haumi e, hui e, tai ki e. Kia ora tātou.